Hi, my name is Tim Andrews. I'm a first-year student in the Doctor of Athletic Training program at Indiana State University. And today I'll be talking about the whole person and kinetic chain evaluation, my personal evaluation. So when I first, before I came to Indiana State, I knew about disablement models. I knew about patient-reported outcomes. However, I wasn't really integrating them into my practice. I typically did not really think about the social, economic, and psychosocial um, parts of how the injury or disablement were affecting the patients. Um, However, I think I really need to incorporate this more into my practice to help to understand and improve compliance. Um, so I think by using patient-reported outcomes will be beneficial. It'll help me to improve consistency and can help guide questions and improve my patient-centered care. Next, we're going to talk about the kinetic chain. So in the past, how I have evaluated the kinetic chain has been pretty inconsistent. It's typically do it by gait analysis, typically when people are walking into the clinic. And sometimes I'll do it during my evaluation to see what's going on with their gait. Or also if I have a patient with a overuse injury, especially if they're a runner, I go do a running assessment to see maybe where in their gait or running gait their issues are coming from. I'll do observations occasionally, looking above and below the injury site, seeing if there's anything very easy to tell, but once again, pretty inconsistent with what I use. Sometimes I'll do evaluations during therapeutic exercise. I'll watch the patients do certain movements and look for deficits in their movement patterns. Or also what I like to use is the NASM CAS overhead squat assessment. I found that it's kind of, it's not a validated screening tool or injury evaluation tool. However, I do think it's good to see the kinetic chain all weighted and to see where those deficits are and what the body is doing while trying to do a squat. It's helpful in identifying muscular imbalances. Then during therapeutic exercise, I like to also have patients do the lateral step down. I'm going to talk about that more. But in the past, it's where I really noticed most of the deficits in the kinetic chain and how I address it. What I kind of realized throughout this process was that injury screening can really help to identify problems with the kinetic chain. Kinetic chain evaluation is typically done, for me at least, during functional testing towards the end stages of rehab, or maybe acutely if they're limping, those types of things. And it's difficult to assess kinetic chain injury post-injury, especially if you have a patient, let's say just tore their ACL, they're not moving that well. Looking at a kinetic chain is going to be difficult to begin with. But by using injury screening tools before participants begin participating in athletics or any part can be helpful first as an intervention to prevent injury, and next it can be used to assess the kinetic chain, kind of use it as a baseline measure to address, okay, I saw in your FMS tests from when you took this 2 months ago before you got injured that you had weak core strength, or you had some trouble with mobility, those types of things that can be helpful in determining the treatment plan. So AT is in a unique position to provide intervention track data after injury compared to versus baseline. That can help improve consistency. So first, what I talked about earlier, the lateral step down test. I use this lateral step down a lot with patients with lower extremity injury as a rehabilitation, and I've noticed problems and addressed them. But I like how consistent this lateral step down test is, can help to improve the consistency of my evaluation. So there's certain criteria, and you score it based on the criteria. In the past, I really just said, ooh, their lateral step down doesn't look good, or ooh, okay, they're fine. But this will help me to improve consistent scoring system. Also, it was found that the results from the step-down test were linked to other interventions and evaluations, such as weight-bearing dorsiflexion. People who had a high score on their lateral step-down test also had low dorsiflexion range of motion. So it's a good thing to during the test to evaluate and check, because I don't usually check dorsiflexion evaluation. So like I said earlier, injury screening and functional testing. Kinetic chain evaluations take time. If I was to do a range of motion and manual muscle test of every muscle and joint, would take a long amount of time to do that, and maybe not have that great functional data. So it's easier to use screening tools and functional tests to find out where those deficits are. Then you can use range of motion manual muscle tests to adjust it from there. So one thing I've been using recently is the Y balance test, and it's been associated with weak hip abduction strength. And so it can be used as a screening and as an intervention. So this will be helpful in identifying patients with injury. Other evaluation improvements I need to do is to improve my back evaluation. I think by using the McKenzie evaluation method, that will really be helpful for me. I also need to integrate kinetic chain and core strengthening testing into my back evaluations. Typically, my back evaluations have just been patients laying on the table, and me palpating and having to do simple tests. So incorporating other things will be helpful in that. I also really think that incorporating injury evaluation algorithms, clinical prediction rules, things like that, will help to provide my evaluations that are consistent. It'll help to improve communication with other healthcare providers, and can link evaluations with treatments. I can really see the difference on what treatments work compared to what the results are from the algorithm. Once again, I realized that my back evaluation is pretty limited. I think by using the McKenzie method will be helpful, and combining with other tests. So before I wasn't really looking at core strength and stability in relation to lower extremity functioning. I just kind of assumed that their core strength was low, or they had some other lower extremity function deficit, and I would adjust it from there. But I think by incorporating tests like the single leg test, dip test, rounded post test, that'll help identify problems and track changes throughout their evaluation to see that things have actually improved. The spine is really complex, and identifying the source of this dysfunction will be really important. And once again, I need to incorporate my injury evaluation algorithms. So my evaluation could be kind of inconsistent throughout the entire body and throughout the entire kinetic chain. And so developing a systematic approach to my evaluation will be beneficial. So I think I need to research algorithms and develop my own algorithms that will help me provide consistent care with patients and with other clinicians, and improve communication. I think it also is really good at prompt evidence-based care. If I'm using this algorithm and it doesn't seem to be working, then I can do research on what the problems are with the algorithm, what are the problems with my evaluation, and I can add and adjust things from there. So I think that rather than just saying, I guess I missed that injury, instead developing and continuing to work on my algorithm to continue to improve care will be really beneficial. Having a systematic approach to evaluations, which can provide support for interventions and treatments. So for instance, by getting an algorithm such as buttock pain in athletes, having 3 questions that I can kind of follow to help to kind of figure out the differential diagnosis will be really helpful in improving my care. So once again, the key points about my evaluation improvement algorithm: using injury screening tools, using things like the lateral step down during rehabilitation or other parts to identify deficits, using research on and developing of injury algorithms, and improvements to back evaluation, and using PROs and valuing the whole person. All these things will really help improve my care. So thank you for taking the time to listen.